Good afternoon. I'm Adrian Dix, BC Minister of Health. To my right is Dr. Bonnie Henry, the Provincial Health Officer for British Columbia. We're honored to be here on the territories of the Lekwungen-speaking people of the Songhees and Esquimalt First Nations. I wanted to lay out what the schedule for briefings will be over the next few days and through the Easter weekend. Tomorrow and Thursday, those briefings will be at 3 o'clock. On Friday around 3 o'clock, we'll send out a prepared statement which will update you on the facts of that day. On Saturday at noon, Dr. Henry will be here briefing, and then the following briefing will be Monday at 3 o'clock. So that gives you a sense of what the schedule will be for the next week. And with that, I'd like to introduce Dr. Bonnie Henry.
Thank you, and good afternoon. So this is our update on the COVID-19 situation here in British Columbia. For today, we have 25 new test positive cases here in BC for a total number of cases of 1,291. That includes 603 people in the Vancouver Coastal Health Region, 458 in the Fraser Health Region, and no change in the other 3 health regions, 79 on Vancouver Island, 128 people in Interior Health, and 23 people in Northern Health. We also have no new long-term care outbreaks today. We remain with 21, and currently there are 213 people in long-term care who have tested positive for COVID-19. That's 132 residents and 81 staff people. Right now, there are 138 people hospitalized with COVID-19 in British Columbia, and of those, 66 are in intensive care unit or critical care units. We have, sadly, another 4 people who have died from COVID-19 in the last day here in BC, 3 people in Vancouver Coastal Health and 1 in the Fraser Health Region. And 805 people have fully recovered and are no longer in isolation. So as we're all aware, there are a number of important religious celebrations that are coming up in the coming weeks, starting tomorrow, really, and in the coming days. And many of us, millions around the world of many faiths, will be celebrating these major religious holidays. And we'll be celebrating collectively around the world in ways we've never done before, in many cases. Our faith leaders, and we had a call with a number of faith leaders from across BC again this morning, are also community leaders and people that we look to for guidance at these times when we're in crises, but also when we have times of these religious celebrations. And I am so happy to see and have been so impressed by how much they have shown through their actions that we can still celebrate and care for those around us in virtual ways. And as a matter of fact, many more people during this time are finding ways to connect with people online through their religious faith, through many different religious faiths. And I encourage people to continue to look for those connections online. We've heard that many, many places have areas online that people can connect to, so I would encourage you to find those numbers. The followers and congregations around the province here in British Columbia, please, now is our time that we need to pay special attention to our elders and seniors. Our elders hold our history, our language, and our traditions, and are a precious part of our communities around this province. And through these celebrations over the coming weeks, please keep that in mind so that we can maintain our safe distance to protect them. We protect them by connecting safely from a distance, and that is an important thing for us all to remember. This is also a time, I know, when many people will be thinking of traveling and going to perhaps holiday homes or smaller communities around the province. And I really am imploring people, this is not our time to do that right now. We need to avoid all non-essential travel, and it's important that we don't go to communities where we might not have the resources to support us if we become sick or if there's a medical emergency. So now is the time to stay home, to stay connected with our family, to stay connected virtually. I also want to say that, group celebrations inside are also problematic at this time. And while we have an order that prohibits people gatherings of more than 50, right now, when we know that this virus continues to circulate in our communities, coming together of even small groups can be very problematic. And if you are coming together as a small group, maintaining those distances, making sure you're doing the things we need you to do, like cleaning your hands regularly, making sure you're covering your cough, that if you are feeling at all unwell, that you do not go and do not bring this into an environment with others. I also want to say today is World Health Day, which is a WHO day where we talk about awareness of health around the world. And I can't imagine more people being aware of health at this point in the world right now. But many people we know in British Columbia are managing chronic disease and other health issues. And I can encourage you to continue to work with your healthcare providers, to talk to your physician's office, your primary care provider's office, or if you don't have a primary care provider, to talk to the UPCCs, to call 811 if you need. It's okay for each of us to reach out, and you can do it safely. You can do it online in many cases, and there are many resources and options for care available for people online now through our community physicians, our family physicians, and community organizations. I encourage you as well to connect with your family physician, the people who know you best and know your condition best during this time. And if you do need urgent care, the emergency departments are there to support you, and 911 and our paramedic services are there to support you. So do not be afraid because of COVID-19, to call for help if you need it. Finally, I just, this is, as I've been saying in the last few days, we're in the thick of it right now. We need to continue to stay united and to stay strong. And as we look ahead to these celebrations with families and friends, let's keep our firewall strong. So this is our time to care and protect each other and our communities and our families across BC. I did want to add one other thing that has been brought to my attention, and they say the number one thing not to do in a pandemic is your own hair, and I will say believe them. And my apologies to Lindsay, my hairdresser, but I did do some of my own tinkering with my hair in the last couple of days. So yes, I did not go to the hairdressers, and hopefully it will settle down soon. But so. Thank you, and remind you all this is a time for us to be kind and to be calm and to stay safe.
Thank you very much, Dr. Henry. This is obviously, again, whenever we provide a briefing on a day when people have passed away, a very solemn day for us and a very solemn day for people in BC. Four more deaths we're announcing today, bringing the sum total of deaths to 43, and we want to pass on to the families of those people, to their co-workers, of their friends, of their communities, our deepest condolences. One of the challenges, I think, in this time, and we all feel this because we all know people in community who have passed away from things other than COVID-19, that this is a time sometimes when we're not able to reach out in the kinds of ways to one another and express our grief in the kinds of ways that we usually do. And but I want you to know that Dr. Henry, myself, the Premier, everyone involved in this effort at every level sees your grief and feels your grief, and we pass on our condolences to all of you. As Dr. Henry has said, we have a number of additional cases today, and a decline in the number of hospital cases. Just for people who are interested in hospital cases, there are currently 59 in the Fraser Health Authority, 51 in the Vancouver Coastal Health Authority, 13 in Interior Health, 11 in Vancouver Island Health, and 4 in Northern Health. That's for a total of 138, which is down from yesterday. And as well, the number of people in ICU is also down from yesterday to 66. I want to put this in the context of what's happening in our healthcare system. Today, for example, we have 549 empty beds in healthcare. That's 58.1% capacity overall, and 50.9% capacity in critical care beds, which means that we've made very significant steps to prepare, as we said from the beginning, to prepare for the worst and fight and work hard together for the best of circumstances. I want to thank everybody who's working in healthcare. I want to highlight in particular, again, those that keep our hospitals clean and ensure that people who are in hospital and are working in hospital have access to food, and who do the laundry and other jobs in healthcare, which are absolutely essential to the success of everyone. They are valuable, and we so admire and so appreciate in these times the work that you do. I wanted to say a couple of other things. The first of all, that we've had continue to have more people rejoin the professions to assist us. That's now 56 physicians, 880 people involved in nursing, including registered nurses and nurse practitioners and registered psychiatric nurses and LPNs and registered care aides rejoin the profession for a significant, in just those two categories, plus 30 re-registrants in the allied health professions, all of whom are participating to help us do what we need to do. I want to note with respect to protective equipment, personal protective equipment, that we have received two major shipments that British Columbia is involved in. One landed on Sunday and one landed on Tuesday. And what we're doing now is a new part of the process for us, because we've had to go outside some of our traditional supply channels in order to obtain PPE, as we go through an extensive process of testing, and that's what's going on right now. I want to acknowledge, as Dr. Henry did, all the faith leaders in BC, 130 who participated in a telephone call with the Premier, with Dr. Henry and myself just a couple of hours ago. And to reiterate what Dr. Henry said, certainly we said it on the call, and faith leaders said it as well on the call, is that there has never been a time when we have to reach out to one another more virtually, to touch base with each other more on the phone or through the internet or through FaceTime or whatever that might be, through services that are virtual. Never a more important time, but also that in this time of major religious events, that people need to not come together in large groups, and certainly not to come together inside, even in smaller groups. Finally, I just want to reiterate, this weekend, at least here in Victoria, and I know in Vancouver, the weather is maybe the best weather of the year we have, but this is not the weekend to travel to second homes and to cottages. Let's enjoy as much as we can under these circumstances, what we have here and the many blessings we have here, but let's enjoy them without traveling, and that there be no non-essential travel, or we certainly would actively discourage it. This is the 12th week Dr. Henry and I have been doing COVID-19 briefings. We started earlier with this, I think, than others, and we made it BC's effort. And all of you know, though, that it knows no borders, and neither does our response to it. Being 100% all in requires a lot of all of you. It will this weekend, it continues to, but we need it now more than ever. When there's some evidence that we are flattening the curve, we need to double down now. It demands, I think, what's best of us, what's best of BC, our strength and our courage and our generosity, our empathy and our kindness. It requires all those things. And that good practice and good learning and good luck flow from these qualities. So let's bend the curve, not bend the rules this weekend. Let's continue to be 100% all in. Let's remain committed to our collective effort to stop the transmission of COVID-19. And with that, happy to take, and Dr. Henry, happy to take your questions. En français, c'est vrai. Merci beaucoup. C'est même le week-end des Pâques en français. Donc, nous annonçons aujourd'hui 25 nouveaux cas pour un total de 1291 cas en Colombie-Britannique. Chaque régie de santé compte des patients, bien entendu. 603 se trouvent à Vancouver Coastal, 458 à Fraser, 79 sur l'île de Vancouver, 128 dans l'intérieur et 23 au nord. Nous sommes attristé de signaler 4 autres décès liés au COVID-19 dans les régions de santé de Vancouver Coastal et Fraser, pour un total de 43 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches. Merci beaucoup, and we're happy to take your questions.
Okay. Before we get started, as always, please press *1 to enter the queue to ask a question. You are limited to one question. And please unmute your phones. You will not be audible until we call your name. First question today is from Manpreet Randhawa from Red FM. Go ahead.
Yeah, my question is to Mr. Adrian Dix, the Health Minister. In Vancouver, there is a Sikh temple on the Ross Street. Its vice president was found to be COVID-19 positive on 26 March. But even after the confirmation, he kept going to the temple. So my question is, why the authorities did not inform the people about it, and why the Sikh temple was not shut down immediately?
I think we have to be very careful about thinking we understand an individual's circumstances. And I know there are many rumors going around about specific places, about specific people, about specific places where people gather. We know that the public health people have been working with everybody who's tested positive for this virus and for their contacts. And so people are being advised when they need to be in isolation. And so I would not comment on any specific rumor that has been going around. And it's not our practice to close down places. So the advice from public health that is given to every situation it stands. And we know that we do detailed investigations on every case in the province.
Next question is from Melanie Nagy from CTV.
Hi there. Dr. Henry, great job on the hair, by the way. But to a more serious question, do we know how many doctors, nurses, hospital workers have had serious illness or died? And do we have a sense of those numbers, of those types of cases are climbing or starting to flatten out?
Yeah, so we do not have any healthcare workers who have died from this. I shouldn't say that. We don't. We know there's one healthcare worker who has died, but that is the only one that we're aware of. Most of the healthcare workers who've been infected with COVID-19 have had relatively mild illness. Some of them have had hospitalizations. I don't have those numbers. We don't collect that information, with the exception of the people that we know are associated with the long-term care homes.
Okay, next question is from Gordon McIntyre, the province.
Doctors, nurses, hospital workers have had...
Yeah, Dr. Henry, what is the protocol when someone tests positive and is sent home to quarantine? Is there a follow-up to see how they're doing? I'm thinking of the 39th fatality on the weekend.
Yes, so there's an ongoing follow-up. So when people are positive and they're well enough to be at home, they have daily follow-up, and it's what we call active daily follow-up with public health. It can take a variety of different sources. Some people it's a phone call, some people it's a check-in. So there are many different ways it's done, but people are followed up regularly. Where we are not following up people in the past, and this is one of the things we're looking to address more effectively, is people who have come in from other countries who are being quarantined now under the Federal Quarantine Act or previously under the order here in BC, and we're asking them to stay home for the 14 days. We have not had ongoing contact on a daily basis with those people. We are looking to do that for the future because we think it's so important to be able to support them to do what we want them and need them to do at this point and going forward. So that is one of the things we're working on with our federal partners. But for people who are test positive, we do follow up with them on a regular basis.
Next question, Keith Baldry, Global News.
Hi, Dr. Henry, Minister Dix. Again, regarding the death of the 40-year-old man, understanding he worked at a facility that where developmentally challenged young adults attend. Has there been any further follow-up testing of staff and people who use that facility by your team?
So I know there are a number of small clusters of cases in some of the group homes, and so these are smaller group homes in the area. And yes, that Vancouver Coastal has been working with those particular homes to ensure that transmission is stopped as much as possible, and to test people who have been exposed, and to facilitate people isolating who have been exposed.
Next question, Cindy Harnett, Times Colonist.
Thanks for taking my question. Today, the Prime Minister talked about Victoria Starfish Medical leading the effort to design and produce 30,000 ventilators. Can you comment on that and tell me if there's any indication of how many of those ventilators BC would get? And in the same vein, in the meantime, while companies are stepping up to produce PPEs, is there an effort to reuse or sterilize that equipment?
I can talk to the second. I actually don't know about that particular initiative around the ventilators, but yes, across the country and actually around the world, we're looking at different methods for reusing. So particularly N95 respirators, and so they are disposable, but they are not single use, and they can be. There's been some studies that have supported that they can be reprocessed, we call it, or sterilized again, or decontaminated from a variety of different methods, and there's been some good studies out of the US about how that can be done. So yes, we are looking at those initiatives here in BC, and there's been some work already, and the federal government is also looking at that, and across the country, on how we could reprocess safely so that they can be reused multiple times safely.
Yeah, with respect to procurement and the enormous effort being led in Canada, led by federal and provincial governments and many people in the community, with respect to actions and initiatives of the federal government, there are agreements in place that ensure that that provinces get access to those, and that will continue to happen. And the federal government, needless to say, will ensure that as well, that people who may have urgent need also get access. And so we've been working very closely on issues such as ventilators, but also issues such as obviously PPE with the federal government. And that partnership, I think, in this past week and especially in this next week, we're very optimistic will bear fruit.
Next up is Georgie Smith from CBC.
Dr. Henry, you just mentioned now's not the time to travel to a holiday home. The Regional District of East Kootenay says it's calling on you to close the Alberta border to non-essential travel for the long weekend. They're worried about Albertans coming to recreational properties and potentially spreading the virus. Would you consider closing the border?
It's not something that I believe I have the authority to do, to be honest, and it's not something that I believe is necessary at this point. Alberta has a very similar concerns, and my colleagues in Alberta have been talking about this. We've been talking about this across the country, and really the pandemic that we're experiencing is very similar to what's happening in Alberta, and I think all of us are taking very similar measures. So I would encourage everybody here in BC to do what we need to do, and I know my colleagues in Alberta are doing the same with people in Alberta.
Glenn Korstrom, Glacier Media.
Hi, Dr. Henry. Thanks for taking my call. The last 3 seniors' homes with the most recently recorded outbreaks of COVID-19 haven't been identified. So I was wondering which ones they are and which are the 3 that no longer have active outbreaks because of a sufficient time period going by.
So I actually don't have the names in front of me, but we have been providing them as a separate list once we got up to the higher numbers, so that I didn't have to read them all out each time. So we'll make sure that that's available at the end of this as well.
Andrea Wu, Global Mail.
Hi, Dr. Henry. I have a question regarding the recent change to the dispatching of first responders, where firefighters are now restricted to purple events only. Over the weekend, you had said this came out of discussions with the Emergency Operations Center and that fire services were not wanting to respond to health calls because of COVID-19 concerns. I'm wondering which cities or departments were part of these discussions, and are you aware that many mayors in the Greater Vancouver region are expressing concern over the unintended consequences of this decision?
Right. So it's a complicated thing. But yes, I did have a very good call over the weekend where we cleared the air about the rationale and what we were doing and why. And it was really quite a bit of misinformation that was out there. And what it needed was a good communication with everybody. So this is a protocol that has been put in place for the pandemic. And it was initiated, we've used a very similar protocol during H1N1 in 2009, but it was initiated by myself a week and a half ago in consultation with some of the fire services, but primarily with BCEHS for two reasons. The primary reason was because we were moving to phase 4 of our personal protective equipment framework. And we knew that we were in pretty dire straits at that point, where we had lack of access to personal protective equipment. So it was aligned with a number of things that we were doing, including cohorting of people in hospital, which you've heard me talk about, and allowing healthcare workers to wear one set of respirator and eye protection for the duration of their shift. We had that same thing happening with the paramedics, where we advised the paramedics that they needed to go to a single respirator for shift unless it was damaged or soiled. So in conjunction with that, one of the other measures we do is reduce the number of people who are potentially exposed to COVID-19 and need to wear personal protective equipment. So that was the rationale for non-paramedic first responders not being called to calls where the paramedics can be there first for the medical calls, to reduce the number of people who have to be at the scene and reduce the number of people who need to wear the personal protective equipment to do that safely. I mean, a third reason, of course, is because we want to protect our fire services as well. They have other very important roles that they need to play, and if they were responding to medical calls where they were potentially exposed to COVID-19 and needed to be off work, that could leave critical supply issues or critical personnel issues in our fire services. So it really was a number of things that were happening to make sure that we have protocols in place that best protect our PPE, make sure that the medical calls get the attention they need, and also protect fire services so that they're available for the other calls that they do, which are, of course, responding to fires and gas leaks and the other important work they do. So it was not a reflection, as it seemed to have been interpreted, of the value of fire services and other non-paramedic first responders responding to medical calls. I will say as well, it was the PPE was the main thing. We also know that call volumes are down because people aren't moving out and about as much, and so the paramedics and the BCEHS and the dispatch service has been monitoring this very carefully to make sure that we do have adequate people who are able to respond in a timely way to those calls. And this is something that is not, I mean, there are ways that we know we have to do things differently in urban centers versus some of the more rural areas where there are fewer paramedics and more fire service, for example. So this is something that has been worked out in a protocol between BCEHS, the dispatch service, and the fire services, and we now have an ongoing stream of communication to make sure that everybody is up to date on how it's working if there's challenges that come up. But the primary reason was to protect the supply of personal protective equipment we had, and to protect those non-paramedic first responders from being exposed in the first place. And I will also say the analogy that we're using in the hospitals, for example, is reducing the number of people who provide care to somebody with COVID-19. So we reduce the number of healthcare workers who are potentially exposed. And it's a very similar analogy that we use in the field. And it is a protocol that unfortunately was misunderstood by some when it first came out.
Rob Monroe, Info News.
Right. Thank you, Dr. Henry. As the curve seems to flatten a bit, we presume you have a plan for a stage in reintegration and easing of these restrictions. So I'm just wondering what that plan is and what are the conditions that might lead to that being implemented.
Yeah. those plans and the conditions are still being worked out. And they are things that there's many, many details to them. So I am not able to tell you what the plan is at this moment. Will tell you there are a number of things that we're looking at that we've been monitoring, including some of the modeling, and I'll be looking to share that with you probably next week to help you understand the details of what it is we'll be looking at and why. And what we also are, very carefully watching is where these things are happening around the world. So we know that Singapore, they've started to increase their restrictions again because they saw an increase in cases. We've been watching, of course, South Korea and places like Wuhan now, but also Sweden and Denmark and what's happening in Germany and other places. So these are things that are ongoing. Hong Kong is actually an example that I've been using quite a bit in terms of thinking about what we can do. And one of the things that I've talked about a little bit is that, we're in for a bit of a ride on this. It's not going to be able to go back to 100% where we were at, in January or at Christmas time, where we were able to celebrate and come together until we have either enough people in the population that are immune to this, which we absolutely don't want to happen all at once, because that means a number of people getting sick and overwhelming of our healthcare system. And that's what we've been focusing on right now. But we will have a period of time where this hopefully will wane. And then we will be stepping up and allowing us to go back to some of the activities that we've been doing. But then we need to monitor very carefully. And if we start to see transmission in the community again, particularly as we go into the fall, we'll need to look at what are the measures that are most important that help reduce those chains of transmission again. And there's a number of epidemiological markers that we'll be looking at. Early on, we talked about the reproductive number, or R0, and that's one of the things that we'll be looking at in our community with our data to help us understand the progression of this over the next weeks to months until we have a vaccine, which is the other way that we can build immunity in our population.
Next is Tom Fletcher, Black Press. Go ahead, Tom.
Thank you, Doctor and Minister. Available hospital beds, it's tracking at about 41%. Is that determined to be enough, or is that all that can be done at this time?
Well, to the extent that we have right now, Tom, 140 people, or 138 today, people who are hospitalized, and we have some 4,500 available beds, I think the answer is yes. But we are also in every health authority, and we've talked about the Convention Center, we've talked about Royal Columbian Hospital, also taking steps to increase that, have the potential to increase that capacity should it be required. But I think where we want to come back is to say that the best way to deal with that is for everyone to be 100% all in, especially as we go through this very, very important period. And that's why we've been talking about, for example, people not traveling to vacation homes, why we've been talking about people maintaining and really being all in, and why it's so important that people come in who are coming back to Canada in this period, ensure that they self-isolate for 14 days, why that's such a priority for Dr. Henry and myself and the Premier and everyone else.
Okay, next question is from Rob Buffum, CTV.
Thank you for taking my question. My question, Dr. Henry or Minister Dix, relates to the previous question from Cindy Harnett about Prime Minister Trudeau's announcement of 30,000 ventilators being manufactured here in Canada. By my last count, BC had between 1,200 and 1,300 ventilators available. I'm just wondering if you're able to make any form of estimate as to whether or not we might need more ventilators, some of those 30,000 at some point here.
I think we showed you our projections and our modeling and where we're tracking right now. So it's not an emergent issue for us at the moment. But yes, we have an agreement with the other provinces and territories about distribution of assets that we acquire as a country, and BC has part of that. Obviously, our concern right now is making sure that the areas of the country that are having the most explosive outbreaks or the increased numbers of people requiring those services get what they need in short order. So we'll be watching very carefully. We would expect to get some of the allocation once it comes. And, you know, it's not, if we keep doing what we're doing, we may not need them right now, but we may need them with another wave in the future. So all of this is us working together across the country.
Just to say, as we reported yesterday, there's new. We've brought both new ventilators and refurbished ventilators into operation in the past 2 weeks. So we now have between 1,400 and 1,500 ventilators, and we're able to as well. If you'll recall the presentation that was made on our modeling and on what it meant for acute care, you saw that we were able to deal with some small gaps that were in place in some regions. So we've taken steps to assign those ventilators throughout the healthcare system, and that's what's going on now. And of course, with our cooperation, our work with the federal government, we would naturally expect a share of additional ventilators that were purchased. But right now our goal is to ensure, by being 100% committed to the measures that have been adopted by Dr. Henry, that our current stock of ventilators will be sufficient.
Sandy Hall, CFAX.
Yes, hi. I hope this isn't too dumb a question, but when people are out on the trails, and we have very popular trail here, Galloping Goose, there's lots of people on bikes and running, and I'm just wondering, when they're going by and huffing and puffing, should we be holding our breath? Should we have masks on? Is that a way that things can transmit?
That would not be a common way that things would transmit. First of all, somebody would have to be sick with the virus, or at least have the virus in their saliva. And it is not transmitted very easily outside. So that's why, you know, our distancing is important, but really important is the distancing inside when we're in enclosed environments with people. And that's where we talk about gatherings inside. We know that this is most often transmitted between our close contacts, people we live with, people we spend time with in close contact, having meals at religious events, those types of celebrations or events or meetings. It's much less likely outside. This virus is susceptible to ultraviolet light. It doesn't spread as well outside as most viruses don't. And droplets spread and drop away and don't live in the environment in a way that can be harmful for us quite quickly. So it would be less risky, particularly, you know, somebody on a bike, somebody who's out running. We do ask people to keep your distance because we don't want people to be in those close environments together, talking and breathing on each other. But having somebody run by you quickly is a very unlikely way that this would ever be transmitted.
Next question comes from Mick Sweetman, CHLY.
Oh, hello. Just a report from the BC CDC on Friday said there were 10 cases in the Island Health region of acquisition in communal settings, such as a facility outbreak. Could you give me an idea of what type of facilities those are?
I'm not sure that that's a correct identification of the data. I'm not sure. Perhaps we can get back to you about that. I'm not sure what you're referring to. We've had 79 cases on Vancouver Island, and right now there's 11 people in hospital. Is that what you're referring to, perhaps?
We can maybe get back to him with that one.
Okay, maybe we can get back to you on that with some details.
Okay.
Yeah, there's no long-term care facilities or other facilities that we're aware of where there's outbreaks on Vancouver Island Health Authority.
Perfect. Okay, Richard Zussman.
Dr. Henry, are you concerned about situations where workers are still traveling, in many cases, to northern Alberta from British Columbia, staying, working there, and then flying back to British Columbia to different communities? Like, does that sort of travel still concern you about potentially leading to more spread?
Yeah, so there's a couple of those types of essential workers in many cases, depending on where they're working. And we know there's a number of large mines and sites in northern BC, as well as the Yukon. And so there is definitely travel back and forth to those areas. What we have put out is guidance that is being enforced by the local health authorities, both in the Yukon, Alberta, northern BC, around how that can be done safely. There's shift changes that are being done. There's monitoring that's being done. So the number of people being involved in those sites has been decreased. That people are staying for longer periods of time, etc. So there's quite a few measures that have been put in place, and the guidance that we're providing is available on the BC CDC website as well. So all of it is to ensure that that type of, as we've talked about before, you can't just leave an industrial site. So people do need to be on there for, at the very minimum, for health and safety reasons. And some ways there's production that needs to continue in some of those sites.
Next question, Jane Side, North Shore News.
Hello, Dr. Henry. I have a question about something that you spoke of a little while ago, which was the chloroquine clinical trials that I believe a number of people in BC had been enrolled in, including people in the long-term care home in North Vancouver. I'm wondering if you can say anything about what's been going on there, or if there's been any preliminary sort of results coming out of that.
Yeah, so the hydroxychloroquine has been used under special access for some people in the long-term care facility outbreak, and as we said, it's part of the international effort to try and understand if it is of value, both in treating people, but also in preventing it in somebody who's been exposed. And unfortunately, it takes time for that information to be collated and for us to understand through the progression of the outbreak whether it makes a difference or not. So we don't yet have enough data to be able to say whether it's working. And all the challenge we have with these types of trials is it takes a large number of people to understand if it's better or worse for people who receive the drug or not. So it is going to be a matter of months before we have a definitive answer. I know there's some preliminary analyses that it will be run within the next few weeks, but the outbreak is ongoing, unfortunately, at Lynn Valley, so we don't have definitive answers at this time.
So we have time for one more question today. And just as a reminder for any reporters that didn't get to ask a question, there will be a statement released this afternoon with all of the information in it. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the Provincial Health Officer's orders, visit gov.bc.ca/PHO guidance. And our last question is from Marcella Bernardo, News 1130.
Thank you. Dr. Henry and Health Minister Dix, I was hoping to ask you about what we're going to do when this crisis is over, and how are you going to be following up on numerous reports that we've been getting that some private care home operators have been cutting corners and pressuring their own staff to work under risky conditions during this crisis?
Yeah, I'll let Minister Dix take that, with the exception of saying that, you know, there's been challenges, as we have recognized even before this, around people who work in various healthcare facilities, particularly our long-term care homes and assisted living facilities. But we know it's a challenging environment for healthcare workers in all settings. And one of the major things that we have done is come up with a plan for healthcare workers in long-term care, assisted living, and acute care to work at one facility, to be focused on one facility only, and try and reduce some of that inter-facility transmission of staff, which can be a way that transmission happens between places. So that's my primary focus right now, is ensuring we're doing everything we can to reduce the chances of outbreaks in all of our facilities in the healthcare sector.
I think I'd say, Marcella, first of all, that people in long-term care are doing extraordinary work, and I think we'd want them all to know that we're with them, and that includes in BC we have about 29,000 publicly funded long-term care beds. About a third of those are health authority owned and operated. The rest are public beds, funded public beds in private and nonprofit care. And I know there's a lot of concerns right now across the system, but I would say this: I think everyone in the sector is working very hard to deliver really good service and really good care and really good supports to the residents of long-term care. And so there'll be lots of questions, and there are lots of questions about changes that we'll need to make in healthcare in the future as a result of this. But right now we're in the midst of it. And I just want everyone to know in long-term care, I know Dr. Henry does as well, is that we're on your side, we're working with you, and we're doing everything we can to support you. I so admire, and I've always admired, the work of care aides in long-term care. I think it's some of the most valuable work that is done by anybody in society. And I think all of us get a sense of this, perhaps when we have someone we know and love in long-term care, we get a sense of that. But the work they do is extraordinary. The work of nurses and others and LPNs in long-term care is extraordinary, and we want to be with them right now and work with them to do our absolute utmost for residents during this period to ensure that that workers are safe and that residents are safe. There'll be lots of questions, and we'll be happy if we get to a point when there's a vaccine and we're moving past all these things to address some of those questions. But for the moment, we're doing our absolute best to keep people safe right now and to ensure that people stay healthy in BC amidst this international health emergency. Thank you very much. Thanks for your question. Take care.
Thank you.